From organ removal to early electric shock therapy, here are 8 ancient treatments for mental illnesses. Before we begin, be sure to subscribe to They Will Kill You. Hit the like button and request any topics you'd like to learn about in the comments section below. Number 8. Organ removal. When reviewing Dr. Henry Cotton's treatments today, it almost looks like a mentally ill person was running a mental asylum. In the early 20th century, Cotton was the medical director at the New Jersey State Lunatic Asylum. He became convinced that mental illnesses were caused by untreated infections in the body. His solution was an experimental procedure called surgical bacteriology, in which him and his staff frequently practiced removal of anything from patients' teeth and tonsils to their colons, stomachs, ovaries, testicles, spleens, and other organs. He reported false cure rates of 85% and was celebrated as a medical pioneer in a historical context that lauded such research. His work was described as brilliant and as providing high hopes for the future. However, Cotton's aggressive and dangerous methods predated antibiotic surgery, and consequently, many patients died from post-operative infections. In reality, almost half the patients that Cotton experimented on had died as results of the procedures. Only after Cotton's death in 1933 did the truth emerge of how destructive his experiments had actually been. Number 7. Female hysteria. Inspired by the teachings of Hippocrates, Plato once compared the uterus to a living creature that wandered throughout the female body, putting pressure on healthy organs and causing disease. The idea of a wandering womb was later established to have been the source for the word hysteria. Popular cures to position back the uterus, aside from the woman having sexual intercourse, also included fumigating of the face and genitals with special fragrances, as well as induced sneezing. Time passed and female hysteria would eventually be used to diagnose most types of mental illnesses that a woman might have exhibited. During the 17th century, hysteria was believed to have been caused by demonic possession. According to the hypothesis of Rachel Maines, up until the beginning of the 20th century, doctors would often treat hysteria by masturbating female patients to orgasm, which eventually led to the early invention of the vibrator. Nowadays, female hysteria is no longer categorized as a mental illness. In its definition as uncontrollable emotional excess, hysteria manifestations are recognized as symptoms of other conditions like borderline personality disorder, schizophrenia, or anxiety attacks. Number 6. Utica crib. Amariah Brigham, the first director of the New York State Lunatic Asylum at Utica, disliked the popular practice at the time of restraining patients using chains. So he created a contraption that would be known as the Utica crib. It basically consisted of a regular bed with slatted sides and a hinged lid that could be locked from the outside. There was barely enough room for patients to turn over. Patients who were out of control were placed inside to calm down, and the key was held by an attendant. Contemporary critics of the contraption compared it to a coffin and described the crib as barbaric and unscientific. There were several cases of patients that died from being put in the Utica crib. These incidents usually occurred when attendants failed to recognize that the patient wasn't out of control and that they were actually having a stroke, a heart attack, or some other type of severe medical problem. Number 5. Insulin shock therapy. Introduced by Austrian-American psychiatrist Manfred Sakel in 1927, insulin shock therapy, also known as insulin coma therapy or ICT, was mainly used as a treatment for schizophrenia. The procedure was developed after Sakel experimented with low doses of insulin to treat psychopaths and drug addicts. One of the patients slipped into an accidental coma, but boasted having a clearer mind after they awoke. Sakel began to wonder if inducing a coma might work for patients that were mentally ill. Through controlled insulin dosage, Sakel induced comas in schizophrenic patients. Either before or during the coma, patients would sometimes experience violent seizures. Sakel and other psychiatrists boasted an 80% success rate for insulin coma therapy, But the procedure had plenty of critics. One of them argued that it made psychiatrists feel like real doctors instead of just institutional attendants. Others later argued that despite being dangerous and inefficient, the procedure was so quickly embraced because there weren't other cures available at the time. The most severe risks of ICT were death and brain damage. The procedure also resulted in hypoglycemia, which made patients sweaty and extremely restless. They also became liable to further aftershocks and convulsions. The procedure was ultimately replaced by neuroleptic drugs in the 1960s. Number 4. Hydrotherapy. There are various forms of hydrotherapy being applied nowadays that involve the use of water jets, underwater massages, ice baths, or mineral baths, all of which may be effective in the treatment of various conditions. However, back in the early 20th century, psychiatric facilities abused hydrotherapy to the point that the procedures resembled punishment. To treat insomnia or depression, patients were strapped in a tub for periods of time that lasted from several hours to several days, while only being allowed bathroom breaks. If a patient exhibited any form of agitated behavior, they would be wrapped in cold sheets for hours on end. The most humiliating and traumatizing procedures were the sprays. As patients were strapped in shower-like stalls, attendants would bombard their naked bodies with either hot or cold, high-pressure water. Number 3. Trepanation. Fortunately, science has progressed far enough so that brutal procedures like trepanation for mental illnesses no longer take place. Trepanation basically involved the use of an instrument to drill holes in the human skull. The shocking aspect is that it's among the oldest surgical procedures to be supported by archaeological evidence. Trepanation dates back to the Neolithic period, around 7,000 years ago, and there are cave paintings depicting its alleged efficiency. The belief was that when a person acted strangely, there were evil spirits in their heads. Drilling a hole in the skull and removing a piece of the bone was thought of as a way of letting the spirits out. At an ancient burial site in France, 40 prehistoric skulls dating back 6,500 years were found with trepanation holes in them. Many of them showed sign of healing in their structure, meaning that the patients survived the procedure. Some would reportedly even wear the removed piece of skull as a sort of amulet to ward off evil spirits. This surgical procedure is still in use today, but the context in which it's performed is a far cry from its ancient roots. Number 2. Lobotomy. In 1949, Portuguese physician Antonio Egas Muniz was awarded a controversial Nobel Prize for the development of the modern lobotomy. He believed that certain mental illnesses could be cured by severing connections in the brain's prefrontal cortex, the part of the brain that's just behind the forehead. Muniz was inspired to adapt the procedure to human mental patients after he'd observed it being done to chimpanzees. Prior to having their frontal lobes removed, the animals were reportedly displaying aggressive and erratic behavior. The first lobotomy, based on Muniz's model, involved drilling a hole in the skull and injecting ethanol to destroy the connections in the prefrontal lobe. He then began working with an instrument called a leucotone, which was inserted in the brain through holes in the skull. It featured a retractable wire loop that, when rotated, cut out brain tissue. Muniz reported his lobotomies as successful treatments, and physicians from countries like Romania, Cuba, Italy, and the US began experimenting with the procedure. American neuropsychiatrist Walter Freeman, who referred to lobotomy results as a surgically induced childhood, took a gruesome step further by developing the transorbital lobotomy. He invented an instrument called an orbitoclast, which was essentially an ice pick. First, it was placed behind the patient's eye socket. A hammer would then be used to drive the pick through the bone and into the frontal lobes. At this point, the ice pick would be swung to separate the lobes from the thalamus. Freeman first performed the ice pick lobotomy on a live patient in 1946. Up until the early 1980s, tens of thousands of people had been lobotomized worldwide. In reality, there are few success stories when it comes to lobotomy. Some patients died as a result of the procedures, while others later committed suicide. Many of those who survived were left inert, intellectually restricted, and emotionally blunted. Number 1. Bergonic chair. Electroconvulsive therapy, or ECT, is still regarded as a last resort in the battle against major depressive disorder and is also used to some degree as a treatment for catatonia, mania, or schizophrenia. In the procedure, a patient is hooked up to electrodes that carry electric current to the brain, inducing seizures. It's the only form of shock therapy currently used in psychiatry. The idea that by inducing seizures, medical practitioners would be able to treat mental illnesses has been circulating since the 16th century. In the era of World War I, for example, patients would be treated with the Bergonic chair, an apparatus used for giving general electric treatment for psychological effect in psychoneurotic cases. However, in its early days, shock therapy was terrifying and closer to torture than treatment. High doses of electricity would be sent to the brain without anesthesia or muscle relaxants, causing cognitive problems, memory loss, and horrible spasms that even resulted in broken bones. Throughout the years, the procedure has been finely tuned to the point that the side effects are reportedly minimal. Despite the fact that it's been used and improved for decades, researchers aren't entirely sure how ECT works. One theory suggests that it modulates connectivity and rebalances the brain. Nevertheless, patients that go through it still risk short-term memory loss, and the effects on the actual structure of the brain are still being debated. Thanks for watching. Which ancient treatment do you think was the most interesting? Let us know in the comments section below.